Singapore has one of the highest prevalence of diabetes cases in Southeast Asia. More than 400,000 people here are living with the disease, and that number is projected to rise to 1 million by 2050. Healthcare providers here are turning to technology and education to improve the way the condition is managed. Sherlyn Seah finds out how they're making a difference to patients.
He's been living with diabetes for 30 years, but the turning point for Richard Ng came 5 years ago. The 74-year-old promised his doctor that he would adopt better lifestyle habits after multiple complications brought on by diabetes set in.
At that very moment 5 years ago, I told him, okay, I will now focus on my diabetic, which is causing few big things that are happening. My eye, my kidney, and I've gone through a lot of surgery in my eye.
So Richard turned to technology to keep his condition in check. He uses a device and app which track his blood sugar levels throughout the day.
In between doctor's visits, in the past we never knew what our patients were doing, but with technology, the technology can help patient monitor his sugars, manage his condition, correlate his eating habits and his exercise with the sugar data he's got, independent of the doctor in between visits. For some of them, it has improved their control of diabetes and understanding of condition.
The push for patients to better self-manage their condition outside of the hospital or clinic also comes at a key time, with more people in Singapore living with the condition because of the aging population. Healthcare providers are now investing in education programs to better empower patients in terms of the literacy and habits. The National Healthcare Group, or NHG, has rolled out a group-based care program. It's to give patients and caregivers a better understanding of diabetes and the long-term care that's involved. More than 100 patients have signed up so far.
There are many patients with diabetes. Everybody do have their set of different problems. We do a one-on-one personalized journey whenever possible. Our care coaches also follow up with patients in different methods. Patients often don't come to us telling us, please educate us in a certain aspect, but we tease out as healthcare specialists and we feed them forward with the information they need.
We have to make friends with our same diabetic patient. Then we get more information how they go through. The most important is how also we have to take care so the diabetic don't go worse.
I wanted to how to reduce the reading, then put me to like what to eat, what type of fruits, what type of food, and what type of vegetable. So I take accordingly .
The initiative is currently available at the Woodlands and Yishun polyclinics. It will be gradually expanded next year to the other 5 polyclinics under NHG.
We have more coverage on diabetes on CNA.Asia, including this article on the direct and indirect cost of the disease, commonly described as a silent killer.